surprise you to learn that the US spends nearly double on healthcare what other wealthy countries do? With that big investment, you'd expect that we were really crushing, or at a bare minimum, meeting important benchmarks, right? Unfortunately, a new study resoundingly demonstrates otherwise. Even though the US is spending much more, Americans are living shorter lives and far less healthy lives. In fact, the US ranked dead last out of the 10 wealthy countries that were assessed, and last or second to last on every single benchmark. One of those metrics was health equity, because in the United States, there is significant disparity between the treatment you'll receive, whether you're rich versus poor, or whether you're white versus minority. To make matters worse, over 25 million Americans still have no health insurance, and about 1/4 of those who are lucky enough to have it are still significantly underinsured. As someone who has been a frequent user of the US healthcare myself, I have seen how badly broken it is, and unfortunately, I'm far from alone. My name is Eileen Filliben Edmonds, and I care deeply about improving healthcare for all. I speak on a variety of topics, including my own personal journeys with breast cancer, chronic pain, migraines, and depression, as well as my mission to shake up US healthcare and bring the all-important patient point of view to healthcare reform. The morning after my double mastectomy at the age of 42, I looked down at my chest. I had expected to be bound up like a mummy, so I was really surprised to see that there was just one large gauze pad where each breast used to be. My mind was racing with questions, and I was overwhelmed with fear about what the future would hold, especially for my 4-year-old daughter and 18-month-old son. In walked the surgical fellow with an entourage of hyper-attentive medical students in tow. I was blessed to be at one of the most prestigious teaching hospitals in the country, or so I thought. Focusing pretty much exclusively on the medical students, the fellow began to read items from my chart out loud. Of course, it was all like hearing a foreign language to me. I waited patiently for him to turn to me. I needed him to decipher all of this medical jargon that was being thrown around, and I really needed him to calm my overwhelming fears. Instead, when he finally did turn to me, he did the exact opposite. He gave me a greeting that was cursory at best, and then, before I realized what he was doing, and with absolutely zero preparation, he leaned over and removed the 2 gauze pads. Voila! The great reveal that I had been dreading for over a month was over in a split second. My husband and I sat in silent disbelief, trying to take in my disfiguring scars and now virtually unrecognizable body. Apparently okay with what he saw, the resident turned abruptly and exited, with the medical students following like imprinted ducks. Wide-eyed, I turned to my husband and I burst into tears. There simply are no words to describe how demoralizing and utterly dehumanizing that experience was. Perhaps more importantly, what was that fellow teaching the impressionable next generation of doctors who were hanging on his every syllable? Unfortunately, the trauma for me was just beginning. The next several months were a blur of emergency surgeries due to complications, multiple rehospitalizations, and IV antibiotics for an infection that simply wouldn't heal. Unfortunately, being diagnosed with breast cancer twice by the age of 42 has not been my only brush with the US healthcare system. I am one of 51 million Americans who suffer with chronic pain, and for years I was part of the elite subgroup of 20 million who suffer with high-impact chronic pain, which is so severe that it interferes with daily activities. This pain sidelined me from a successful career, first as an attorney and then as a consultant. It also drove me to multiple years of opioid dependence. In addition, I've had 15 major surgeries as an adult, 10 of which were within a 10-year period. I've also suffered from severe chronic migraine. One of my migraines was so severe that it mimicked a stroke and paralyzed the left side of my body. As you might imagine, these experiences took a crushing toll on my mental health. At one point, I simply didn't want to live anymore, and I almost took my own life. During this enormously rocky medical journey, I have experienced patient care ranging from absolutely angelic on one side to unconscionable on the other. As one of the wealthiest countries in the world, the U.S. simply must do better taking care of people when they are their most vulnerable. It is one thing to suffer from serious medical issues and another thing entirely to be victimized again and again by the system that is supposed to help. Medical professionals are suffering too. The highly flawed insurance system robs doctors of precious time with their patients, puts financial incentives in all the wrong places, and makes them spend, and some would say waste, a lot of time on endless paperwork and phone calls simply to justify their medical decisions. And the influx of private equity into U.S. healthcare is only exacerbating these significant problems. Things must change. The great news for me on a very personal level, they already have. I have been on a remarkable journey of healing and hope over the past 2.5 years. I have been using research and tools to calm my over-anxious nervous system out of fight, flight, or freeze, and to rewire my brain to correctly interpret signals as safe rather than as pain, migraine, or anxiety. These therapies, which are currently taught in only about 5% of U.S. medical schools, have literally given my life back. I feel better today than I have in the past 16 years. Now I'm on a mission to bring the all-important patient point of view to healthcare reform. At the national level, we must lobby for big changes. We have seen the system and its many flaws up close and personal. We can use our lived experiences as well as our agency to drive meaningful change within healthcare. All Americans, regardless of their bank account or their skin color, deserve local, affordable, quality care. The shocking rise in the number of healthcare deserts in the U.S. is no doubt a crisis waiting to happen. Second, significantly more research must be funded into women's health issues. We need to make up for the literal decades they were excluded from clinical trials. The financial incentives must change. They must move from rewarding and perpetuating sick care to finally prioritizing and reinforcing well care. Fourth, the U.S. system needs to find ways to destigmatize and support the mental health issues of patients, caregivers, and providers. Winston Churchill once said, "Healthy citizens are the most valuable asset any country can have." Clearly, the United States has a very, very long way to go. I believe that patients can lead the way to better health care for all and a brighter future. I'm ready. Are you?